Good morning, everybody. Are you guys ready? Good morning. My name is Matt Constantine. I'm the Director of Kern County Public Health. I appreciate you being here this morning. We wanted to provide you some current information about COVID-19 in Kern County. This morning at 4 a.m., we were notified that a non-Kern County resident, while visiting Kern County, has tested positive for COVID-19. This will not be reported as a case, as this person is a visitor and resides outside of Kern County. We are currently investigating this person's close contacts. None are symptomatic at this time, and we are going to continue to monitor as they self-isolate through the incubation period. We have identified 5 household contacts, and we are, again, continuing to look at other close contacts. The healthcare facility that evaluated the patient is assessing all healthcare providers who may have been in contact with this patient, and we've asked them to report anybody that had unprotected exposure to that patient. It's important to note that the risk in Kern County remains low for disease transmission. We are going to continue to monitor this patient, and we will provide you regular updates. I want to talk a little bit about what we are doing in Kern County. There has been a number of questions and interest on testing in Kern County. There is currently no shortage of either the ability to get tested or the testing kits. We have a number of healthcare providers that are providing testing. Omni, Priority Urgent Care, Accelerated Urgent Care have all are sampling now. They have set up drive-through facilities and even tents. All of our hospitals have the ability to test currently, and the laboratories that they are contracted with are ready to accept samples. So the testing procedures are in place. To give you just an overview, in the U.S., as of March 15th at 4 p.m., we had 3,536 cases with 68 deaths in 49 states. In California, as of March 15th at 6 p.m., we had 335 cases with 6 deaths. And there have been a number of California counties that have identified community spread of COVID-19. That is not the case in Kern County, however. As we've mentioned before, we have a CDC monitoring program where we have 30 returning travelers that we have monitored. 22 have either not needed monitoring after a risk assessment or have completed their 14-day monitoring period, with the remaining still in that monitoring program. We have also received 84 notifications from physicians and healthcare providers that they are testing. 36 of those are currently negative, and the rest are pending. You have seen recently some updates from the governor about different efforts that the state is recommending we take on a local level, from mass gatherings to restaurant and bars and to nursing homes and retirement homes. And public health is actively meeting with all those entities to ensure that we're doing everything we can on a local level to help prevent potential exposure and potential transmission. And finally, let's just not forget that the common sense methods to prevent disease transmission still exist today. Washing your hands, limiting hand contact with unclean surfaces, limiting touching your face and your mouth. When you're sick, stay at home. Avoid going to work when you're or school when you're sick. Avoid family and friends when you're sick. Cover your cough and your sneeze. Avoid others that are sick. You've seen this separation, the social distancing of 6 foot. That 6 foot separation dramatically reduces the likelihood of exposure. And this is a time for us all to pull together. This is what Kern County does well. We need everybody to do their due diligence, but also take care of each other. Take care of your family members, take care of your neighbors, take care of your coworkers, ensure that we are all in this together. That concludes my formal comments. I'm happy to take questions as a group, or we can do it on one-on-one, whatever you'd like.
So you mentioned that this isn't being considered a case here in Kern County, so I would imagine, do you guys have information on whether this patient contracted the disease in Kern County or had it elsewhere before coming in?
So we are still evaluating the patient and determining where potential exposure occurred, but at this time we don't know.
And just from my understanding, so if they did actually contract it here in Kern County, then would we confirm that then would we consider that our case?
No, sir. It's where the person actually lives. That's determined.
Are you able to disclose the city or the county in which that person lives?
We are not.
How are you tracing back contact with people in Kern County?
So we are in contact with the patient, physical contact. So we are talking in depth about where this patient was and their movements and where they've been, from family members to close contacts to locations in the community, to try to determine if there was the potential of any exposure to anywhere in Kern County.
Can you describe the nature of this person's visit to Kern County?
A visitor.
You said there's 5 household individuals with this patient. Does that mean that he was with 5 people in that house here in Kern County?
We have identified 5 household contacts in Kern County.
Is this person still in Kern County?
The person is still in Kern County. According to the procedures, once you are tested, you're asked to self-isolate until you have the results. So we've asked the patient to continue the self-isolation until we have an ability to further assess potential risk.
Are they isolated in a home residence in Kern County, or is this in a more hospital?
They're isolated at home.
Which medical facility were they tested at?
So we're not going to disclose too much information because of the privileged nature of the medical records, but they were assessed by a local healthcare provider.
Okay, and then I know there's some different age ranges. So what can you tell us about gender, age?
No, we're not going to disclose any information about the patient, just that it is a non-Kern County resident.
Well, we understand that there's a certain age caliber. Yesterday you were telling me that we already understand certain parts of the disease when it comes to
Sure.
younger individuals contracting it. I think knowing this person's age or whether they had a compromised immune system would help us better understand how this disease works.
Sure, so we take that health information very serious. We are not going to release information, medical information about that individual. But you are correct, there are certain groups that are more susceptible to COVID-19, and our messages, and the governor's message has been very strong about certain individuals with chronic health conditions or older people, older than 65, should take stronger action. And so those common sense approaches to this disease remains active.
I think you really kind of tell us now that we should be expecting a case. I feel like we're kind of delaying what might be inevitable. We will have one case here eventually.
We are actively testing, as we've talked about. We're monitoring it closely. We have seen other counties and other states that are affected by the disease. We don't believe Kern County is immune. We are lucky to say at this point we don't have any positive Kern County cases, but we're actively tracking it and providing daily updates.
Can you describe the spirits of this person? Are they worried? Are they concerned? Are they like, I think I feel fine?
So we're in contact with the individual. We're having, they're cooperative. We're discussing the patient's movements and symptoms. So it's a good, positive relationship that we have, and the patient is being cooperative and understands the interest.
Can you remind us, just if someone does come down with it, just how propensity to make sure that they will come out of it on the other side? It's not a guarantee you're going to pass away.
Right. So as we've been saying, about 80% of those have mild or moderate symptoms. So most people recover on their own. They might miss some days at work or school, but in most cases, they stay at home and they get better. It's a self-limiting disease, and they return to work shortly after.
You
So, sure. So there were 84 notifications that we've received that tests were being performed. 36 of those are negative. The remaining are pending. As we receive updates, we can provide updates to you. We do try to provide daily updates that include that data. And it's a dynamic field, of course. So more and more people are being tested. And so we ask that the doctors provide us notification when they are running a test, because at that point they suspect an illness. And then once we get those results, we report those out.
Now, I know before you mentioned there's no way to track how many people in the county are currently being tested because there is a lot of private labs that are offering testing. Is that still true?
So let me clarify. So anytime a healthcare provider or a physician suspects that this individual may have COVID-19 and they are going to run a test, they are required by law to notify public health.
So then at this time, 86,
84
are the total people in the county that were being tested?
Yes, ma'am, that we're aware of.
And speaking of that testing, what are the guidelines? Because we've been getting so many, inquiries into our newsrooms of people who felt sick, trying to go to a medical professional, saying, "Hey, I'm having these symptoms," and weren't tested for COVID-19.
Sure.
Can you remind us of the guidelines? What are the guidelines?
Sure. So prior to last Monday, so about 8 days ago, the CDC and the California Department of Public Health had specific criteria, certain conditions that must have been met. And that testing had to be pre-approved by Kern County Public Health and the state health department. That has all changed. Now it is left to the clinician's discretion to determine if those symptoms are consistent with COVID-19, and then they are allowed to sample themselves. So it is the doctor's discretion completely on how and who to test.
For people who feel like they have these symptoms, I know in previous weeks we said, either say, ask for a team to come to your house, don't go to the hospital. What do you
Sure.
recommend now?
So, good precautions. If you believe you're symptomatic, we would ask that you call your physician and make them aware of your interest. We are concerned, of course, if you're symptomatic, we don't want you to potentially expose others. Different healthcare providers have different procedures in place to limit that exposure, but it depends on who your private physician is.
Can you speak a little bit about how these drive-through testing, places are going to work?
So we've just been learning about what some of the private entities are doing for drive-through testing. We've heard that Omni is proposing, I believe, 4 drive-through clinics. I believe Accelerated Urgent Care has 1 large drive-through clinic they're trying to do. We're just learning about the logistics of how they plan to walk or drive individuals through it. I don't have details. You'll have to ask them a little bit. We've called and asked for information so that we can get it out to the public, but that was as of this morning, so we still don't have the details.
They're supposed to open today, so as of right now, they're already operating and operating.
That's what we understand.
Can you, I know, when we have cases of measles, we say measles happened here at this Popeyes or whatever. Can you say where this patient was?
So we don't know yet. We're still investigating to determine if there was a concern where the public may have been exposed and the public needs to know for the protection of their health, then we will go public with that information.
Can you remind us of how long this person was in town for?
So I don't have all the details right now, and some of it I want to refrain from discussing in detail because, again, it relates back to the individual. So I don't have specifics to tell you today. If it's of relevance for community health, right, so that matters so that we can control transmission, then we will release that. But at this point, that's not what I'm going to talk about.
Well, okay. I think it'd be of best public interest if, it's a person been here for 2 weeks. No, really.
Sure.
Have they been here for 2 days?
Sure.
I think that does make a little difference. You can't go into detail. Can you give us just a ballpark of how long?
So to answer your question directly, I don't have specifics yet. That's part of what our investigation is involving. If that is of relevance for the protection of the community's health, then we will release that. But at this time, I don't have specifics.
Are you allowed to release what city this person was visiting?
No, just Kern County.
And what's the
I'm sorry?
Are they doing okay? Like, are they
Yes. So the again, I'm not going to go into great detail. The patient is recuperating and it has improved.
You said the individual plus 5 family members that are being looked at?
As it stands now, we have five household contacts that we are beginning to investigate, and then we're assessing if there's other close contacts that we need to investigate.
Were one of those 5 to test positive, that would be a confirmed Kern County case?
If we have a Kern County resident that is tested positive, then yes, that would be a case, a
And
confirmed.
those 5 are residents?
I don't know.
Okay.
That's part of our investigation.
But it's not 5 people like visiting at the same time, right? It's like they are here and this person's visiting them.
I have 5 household contacts that we're going to look at. At this point, that's the detail I have.
So to confirm, this person, you said they did not have symptoms, they were asymptomatic?
No, I did not say that.
And sorry, this has already been asked, but are they in a medical facility right now, or are they at home?
They're at home. They're recuperating at home.
There's also, the governor suggested for, different public places to close,
Sure.
bars, nightclubs,
Sure.
all that kind of stuff. And there's still some businesses, to their right, not closing, here in town. Some are, some are not.
Okay.
When is public health going to get involved in
Sure.
this?
So we have been involved since day one, where we have been trying to implement the recommendations, initially from the California Department of Public Health and then from the governor. We've had a number of meetings, personal meetings, a number of phone calls, and a number of conference calls with different affected groups, because these recommendations affect a wide variety, from churches to bars to nursing homes. We've met with many of them in person, reiterated the guidelines, and more importantly, reiterated why this is important. Everybody has been very open and understanding of the need. We understand that there may be some that are suffering a significant economic impact from some of these decisions. We have indicated that our health and the health of their employees matters more. We are, with the governor's new recommendations from last night, we're actually notifying all of our restaurants and food facilities about those, so they'll get a letter and an email. But it's changing quickly. So as more information comes out, our intent is to get it to them and to reiterate the importance of adhering so that we all are protected.
What would it take for the risk level to increase? Because it's been at the same
Yes.
level for a long time, and it seems like it's riskier now than it was 2 weeks ago.
So I'm going to disagree. Currently, there is a low risk. We have no evidence of community transmission. We have no cases of Kern County residents. If we see other positives, if we see that it is more than just a household contact, then we are going to state that the risk is greater, right? If we see, like in some other counties have seen community transmission, not from a close contact, not from a household contact, that would change our approach, and then I think the risk would increase.
And just piggybacking off of this, I think part of the idea is it's low risk, but look at the impact it's having in Kern County. All schools,
Yes.
K-12, are closing.
Yes.
Businesses are closing. Fire stations said they're closing part of their station. So I
Yes.
think part of it is, why all of this? Can you remind us, if it's such a low risk,
Sure.
why such an impact in our community?
So it's a low risk today. So the actions that you've seen from the superintendent of schools, from the county government, these are actions taken to prevent the potential spread in the future. And those actions, we're hopeful, will make a difference. And for those that are immune compromised, this might make a big difference to an individual. And if we can stem that transmission, if we can make that impact on that one person, then these efforts are worth it.
And what's the household contact? Can you define that?
So it's somebody that generally is within the same house. They reside in the same household. It doesn't necessarily need to be a family member, but usually is.
And house is general, it could be an
It
apartment,
is.
hotel room.
House is general, but we're looking for somebody that you're coming into regular, routine contact with. Anything more? Thank you, guys. Thank you for coming.